Next, we will discuss about what are the clinical symptoms of fatty liver. That is, what are the signs and symptoms. So, in many cases, fatty liver causes no noticeable symptoms, but you may feel tired or experience some discomfort or pain in the upper right side of your abdomen. Some people with fatty liver disease develop complications including liver scarring, and liver scarring is also known as liver fibrosis, and if you develop severe liver fibrosis, it may lead to cirrhosis of the liver and finally into liver failure. Now, if cirrhosis occurs, so cirrhosis may cause symptoms such as loss of appetite, weight loss, weakness, fatigue, nosebleed, itching of the skin, yellowish skin and the eyes, web-like clusters of the blood vessels under your skin, abdominal pain, abdominal swelling, swelling of your legs, breast enlargement in men, and lastly, it leads into confusion of the mind. So these are the various signs and symptoms of fatty liver disease. Now next we will discuss about the investigations and diagnosis. It's very important to diagnose whether you are suffering from fatty liver disease or not. So through these methods, one can know whether they have this fatty liver disease or not present in their body. So let's talk about the investigation and diagnosis. So first part of investigation is medical history. So, if your doctor suspects that you might have fatty liver, they will likely ask you some questions about: first, your family medical history, including any history of liver disease. Second, your alcohol consumption and other lifestyle habits. Third, any medical condition that you might have. Third, any medications that you might take. And the last, recent changes in your health. And the second part of investigation is physical examination. So, to check for liver inflammation, your doctor may palpate or press your abdomen. And if your liver is enlarged, they might be able to feel it. And however, it is possible for your liver to be inflamed without being enlarged. Your doctor might not be able to tell if your liver is inflamed by touch. So, another investigation after physical examination are blood tests. So, the third investigation, that is blood test. So, in many cases, fatty liver disease is diagnosed after blood test. And the blood test shows elevated liver enzymes. For example, your doctor may order the ALT, that is alanine aminotransferase test, and AST, that is aspartate aminotransferase test, to check your liver enzyme. And these tests might be recommended if you have developed signs or symptoms of liver disease. They might be ordered as a part of routine blood work. Elevated liver enzymes are a high sign of liver inflammation. Fatty liver disease is one potential cause of liver inflammation. If you test positive for elevated liver enzymes, your doctor will likely order additional tests to identify the cause of inflammation. After blood test, the next, that is a fourth investigation, that is imaging study, that is CT scan, MRI, ultrasound examination. So, your doctor may use one or more of the following imaging tests to check for excess fat or other problems with your liver. That is ultrasound, USG examination, second CT scan, and third MRI scan. And they might also order to test known as vibration controlled transient elastography, that is VCTE or fibroscan. This test uses low frequency sound waves to measure liver stiffness, and it can help check for scarring. Another investigation, that is liver biopsy. So, liver biopsy is considered the best way to determine the severity of a liver disease. During a liver biopsy, a doctor will insert a needle into your liver and remove a piece of tissue for examination. They will give you a local anesthesia to lessen the pain. This test can help determine if you have fatty liver disease as well as liver scarring. So this was all about the investigations and diagnosis for fatty liver disease, which may help you to know whether you are suffering from this disease or not. And after investigation, the very important part, that is management part. Now let's discuss about the management, treatment and prevention. So to prevent fatty liver and its potential complications, it's very important to follow a healthy lifestyle. So first of all, limit or avoid alcohol. Take some steps to lose weight. Make changes in your diet. Maintain a healthy weight. Eat a nutrient-rich diet that is low in saturated fat, trans fats, and refined carbohydrates. Take some steps to control your blood sugar, triglyceride levels, and cholesterol levels. Follow your doctor's recommended treatment plan for diabetes if you have it. Next, aim for at least 30 minutes of exercise daily, most day of the weeks. Taking these steps can also help improve your overall health. Lifestyle changes are the first-line treatment for fatty liver diseases. Depending on your current condition and lifestyle habits, it might help to lose weight, reduce your alcohol intake, eat a nutrient-rich diet that is low in excess calories, saturated fat, and trans fats. Get at least 30 minutes for exercise most day of the week. And now we will discuss about the diet. They would like to recommend you a diet for fatty liver disease. So let's talk about it. So diet for fatty liver disease. So if you have fatty liver disease, your doctor might encourage you to adjust your diet to help treat the condition and lower your risk of complications. For example, they may advise you to do following things. First, eat a diet that is rich in plant-based food, including fruits, vegetables, legumes, and whole grains. Second, limit your consumption of refined carbohydrates such as sweets, white rice, white breads, and other refined grain products. Third, limit your consumption of saturated fats, which are found in red meat and many other animal products. Next, avoid trans fats, which are present in many processed snack foods or junk foods. And lastly, stop drinking alcohol. Avoid alcohol. So these are some ways of management and the diet plan for fatty liver disease. What is the basic pathogenesis? What are the various types? And what are the etiologies and what are the risk factors? How you can diagnose and investigate whether you are suffering from fatty liver disease or not. And lastly, we have discussed about the management part, how one can prevent it and how one can manage. And we have also given some dietary plan, diet recommendations for you guys, those who are suffering from fatty liver disease. So that's all. That's all for today. See you guys in our next video. That is how you can manage fatty liver disease with homeopathic medicines. In the next video, we will discuss about top homeopathic medicines which are chiefly used for fatty liver diseases. Till then, stay connected with us for more videos like this. Don't forget to subscribe and comment below. And yes, thanks for watching our video.